Good afternoon, everyone. I'm Rick Journey. I'm the moderator for this phone call. Thank you for being with us, joining us at this time. Just a couple of things to remind you about as we go through this call. We will, if you have a question during this call, press 7 on your dial pad, press 7, and a screener will take your call and we'll put it into the system so that we can follow up and ask these questions while we're on the call. In addition, we will be asking for some information from you as well, just to be able to learn more about your thoughts and situation right now. So we will give you an opportunity to give us feedback throughout this call. With that, I would like to introduce now Mayor Randall L. Woodfin.
Hey, good afternoon, everyone, all the employees who were part of the Birmingham Fire and Rescue. I want to thank you for being on this call. We will attempt to be very brief. When I say we, on the call is myself along with Chief Moon, and he has his leadership team with him. What we'll do is have some opening remarks, and then we'll try to get into as many questions as we can get into. You know, in many instances, fire professionals are the first responders of the first responders. And so your role has always been critical to the city, and today it's even more important than ever based on what we're dealing with. Now, I'm speaking with you all this afternoon because I know many of you all are concerned. You're concerned about your families, you're concerned about the professionals to your left and your right, and you're concerned about the residents you serve. My first line of concern is with you all of you. So let me and your leader, Chief Moon, tell you what we're doing for you at a high level, and then we can answer some of your questions. As you know, first this week, as of yesterday, we put into place a shelter-in-place order. Now, this is for the benefit of our residents, but we also believe it's a benefit to you. If we can have every opportunity to decrease the number of potential people you may come in contact with, then that softens the burden on the entire community. In addition to that, Chief Moon has assured me that you all have the protective gear you need today and for several more weeks. And we've placed a significant order for supplies and should have it in place with time to spare. And so I want to make this very clear. We do not have a supply shortage of PPE. And at some point, Chief Moon will chime in on that. I just have one more note, actually, before I turn it over to Chief Moon, which is this. I want to urge each of you all to follow all the protocols for engaging the public, especially calls that are specific to residents bearing flu-like symptoms. Bottom line is we need you to be safe because we care about you. Now, I know there are a lot of questions, but before we get into that, I want to turn it over to Chief Moon to allow him to share some comments with you.
Good afternoon, Birmingham Fire Rescue family. So what the mayor said is exactly correct. We're constantly conducting inventory on our PPE and supplies. We're monitoring our burn-through rate daily. We ordered and received supplies from EMA on Saturday, and just as the mayor stated, we recently placed another large order, and we should receive that pretty soon. We're doing our PPE inventory weekly. Just over the past 2 weeks, we sent out nearly 800 N95 masks. What we have to do is we have to conserve the PPE that we do have. Right now in stock we have over 12,000 N95 masks, which sounds like a lot of masks, but we have to conserve what we have. The mayor talked about following the protocols that we sent out. Our primary concerns as the leaders of the city and the leader of the department is the safety of our personnel and the safety of our citizens. We've been spending every second of every day looking at best practices, consulting with leading experts, our healthcare partners, to make sure we're doing the things that will keep you and your family safe. That's why we're doing some of the things that we've done so far, like adding an additional EMS supervisor, adding an additional safety officer. We put those ID units in service to assist with some of those calls. We ramped up overtime personnel. We also created 2 incident action plans over the past 2 weeks. We've also developed and disseminated some of those ID response guidelines to walk you through each step of these type of calls. We also purchased decon equipment to decon our stations and our apparatus. One of the things that I need you guys to remember is on all the calls that we go on now, we have to screen all our patients and make sure we limit the personnel who conduct the assessment. Again, our primary concern is your safety. So that's what we're looking at. That's what we're working on every single day, every single second. So I want you guys to be safe out there. And, you know, if you have any questions or concerns, you can always get those to us, and we'll answer as fast as we can.
I know, and so as Rick Journey told you all, the protocol, if you have a question on your keypad, press 7 and submit your question. But I'll go ahead and anticipate, I think one of the top line questions is, if Birmingham Fire and Rescue Service personnel test positive for COVID-19, will it be treated as a work-related exposure? The answer is yes, and it will be under workers' comp. I know I'm going to now turn it over to Rick Journey, who will guide us through the process for the remaining of our call.
Thank you, Mayor. So once again, as the Mayor just said, if you have a question, please press 7. We have screeners standing by. We will get those calls in immediately afterwards. I think they're working on them right now. Let me also, as we mentioned, we're going to ask questions of you as well. We want to see what your thought process is right now. So I'm going to read a few questions. You'll have 3 minutes to respond to this first one, and then I will give you a reminder when we're about to close it out before we go to the next one. Our first question: do you feel that you have received adequate information regarding COVID-19 from your department? Press 1 for yes, press 2 for no. Once again, the question: do you feel that you have received adequate information regarding COVID-19 from your department? Press 1 for yes, press 2 for no. You have about 3 minutes to respond to that, and we will remind you before we close it out. Okay, so we are pulling up our next question. Stand by for 1 moment while we do that. So we have a question here that says, I recently filed for retirement. Will this affect the time frame of my retirement?
That is an HR question. I will tell you, whoever that employee is, why don't we do this? I do know Ms. Medizik will be a part of this call in a minute, so we'll pause on that question and be sure we can get you an answer. But at a high level, I would imagine, because that's a question dealing with retirement, that's something that HR can answer for that individual employee.
So we will follow back up when Ms. Medizik is able to join us on this line. Okay, I think it's Ms. Medizik. Jill Medizik, are you on the line right now? Okay, I do not believe she's on the line at this moment. We will follow back up and check in 1 moment. Our next question, the caller states, on a known COVID-19 exposure, the crew responsible for transporting the patient were only held for 48 hours before reporting back to duty. Why are we not following the CDC's recommendation of a 14-day quarantine?
On these type of calls, we're looking at significant or insignificant exposures. When personnel are wearing the proper PPE, there's no need to make them be quarantined or isolated for 14 days unless we have signs and symptoms or if there was a breakdown in PPE. So we're leaning on the experts that we're dealing with as far as our community partners in that response.
Our next question: are you going to provide isolation gowns for first responders?
We have isolation gowns on the rescue units currently. Right now, we don't have enough to put on every engine company, but the ID units and some of the rescue units do have isolation gowns.
Okay, we have given about 3 minutes to the response for the first question. Once again, I'll ask it: do you feel that you have received adequate information regarding COVID-19 from your department? Press 1 for yes, press 2 for no. You will have another 30 seconds, and then we will close out that question and go to the next question. A reminder again, we have several calls on there, but if you have a question, press 7 on your dial pad. You will be linked into a screener, and that screener will be able to gather your information. I do believe that we have Ms. Jill Medizik from the HR department on the line now. I just want to confirm. Ms. Medizik, are you on the line?
Rick, I am.
Okay.
Can you hear me?
Yes, we can. Thank you. We did have a question earlier. We want to follow back on up to it. A caller asked they had put in for retirement recently. Will this change the timeline of that retirement?
So HR is working diligently to ensure that all of the pension applications are being processed. As some of you are aware, the pension board, the secretary is actually the Dr. Lauren Oliver of the PBJC, and he has indicated to us that although the PBJC is teleworking, that they will be prepared to move forward with the meeting in April.
Thank you very much, Ms. Medizik. We will move on to our next question as well. We have a question. Company officers are being asked to certify that employees have not been exposed. However, if an employee does not know if they've been exposed, how are the officers supposed to certify?
So, Rick, can you repeat that question once more so I'm sure I understand it?
Yes. Company officers are being asked to certify that employees have not been exposed. However, if an employee does not know if they've been exposed, how are the officers supposed to certify? I think Chief Moon.
So we're doing our morning screening of each employee to answer those 2 questions, and each of these ID calls that we go on, we're asking personnel to document each of those calls, and we're tracking each of those calls through a spreadsheet and that exposure form that we recently sent out. So that's the way we're tracking all these exposures.
Thank you, Chief. Our next question that we have for you: do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer. Press 2 for somewhat safer. Press 3 for not much safer. Once again, the question: do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer. Press 2 for somewhat safer. Press 3 for not much safer. We will keep this answer Q&A open for the next 3 minutes. You can respond now. We will remind you before we close it. In about 3 minutes, you will have 30 seconds at that time. Let's go to another question from one of our callers. If we come into contact with a patient who is tested positive, will employees be quarantined from their families in order to protect them?
So on this question, everybody who can hear me, HR and the leadership of the fire rescue have been working hard to get this question answered. Very candidly, that is a work in progress. And so today on this call right now, they're not in a position to answer that question. But I am more than confident before this week is out, we will have been able to fine tune and make sure it's an adequate response to address this issue, because we know it's come up more than once.
So our next question, this is a question for Chief Moon. How can a firefighter get tested for COVID-19 if he or she has had an encounter with a citizen who is tested positive for COVID-19?
So if we have any of these instances come up, this is where the proper reporting through your supervisor getting in touch with safety, and then safety relays all that information to OHS, and then we can set up testing through OHS and HR.
All right, thanks, Chief. I want to remind folks of the question that we have for everybody to respond to at this moment. Do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer, press 2 for somewhat safer, press 3 for not much safer. You have 30 seconds to respond. Again, I'll remind you, if you have a question, you can press 7 to ask that question. Let's move on to our next question. Give me a moment to pull the next one up. So this question is, the CDC has said that you can be a carrier of COVID-19 and show no symptoms. How are we protecting firefighters from people who are not showing signs? Will we be covered if we are not tied back into or are tied back to a documented case of COVID-19?
Okay, so part of the way we're protecting our firefighters is we've sent out all the information on how to screen personnel. Make sure you stand back 6 feet. We need to limit the amount of personnel who are assessing the patient first. But if you come into contact and if you come down with the virus, that will be taken care of through the department.
Our next question, Jill, I believe this is a question that you can respond to. How long will they be able to pay non-essential employees, or will the additional positions remain?
At this time, Rick, there has been no decision as to how long non-essential employees will be paid.
Okay, thank you, Jill. The previous question was answered that we asked of you or is closed, so I'm going to ask you our next question. Have you or anyone that in your household been tested for COVID-19? Press 1 if yes. Press 2 if no. Once again, have you or anyone that is in your household been tested for COVID-19? Press 1 for yes. Press 2 for no. That call will be open for 3 minutes. Stand by for our next question.
I can have some
Okay, so let me ask our next question. Why were we not better prepared to address virus or be proactive?
I think what you all are witnessing in Birmingham and the state and the country is a really good question. I think no one that was in America was prepared, and apparently as it relates to the CDC or any recommendations as it relates to human health services at the federal level, it seemed that those recommendations given to the federal government were not necessarily taken seriously. I can't speak to the state. I can speak to based on what we're doing here. The city of Birmingham as a government is taking this very seriously. We are listening to our health officials every day and attempting to flatten this curve. We had no cases in the state of Alabama 13 days ago, and we got our first case in Montgomery County 2 Fridays ago, and as you know now we're over 100 cases, and so this is moving at a very rapid rate, and everything we're doing now is to flatten this curve and prevent community spread. There will be no satisfactory answer on that. I can't speak to what happened at the state level or the federal level to prevent this spread based on what was happening in other countries. But I can tell you everything we're doing from a local level is to protect the citizens in the city limits of Birmingham.
So, our next question, stand by for just one moment. This is about PPE. Can I wear an N95 mask on every call if it makes them feel more comfortable? Only one mask for the entire shift? Question mark.
So to this question, there's been some discussion through ADPH about reusing masks. That's a continual conversation. If we wear masks on every call, we will deplete our supply faster than we can actually keep up. So we are having more discussions about the reuse of PPE. That's an ongoing conversation.
All right, thank you. Let me remind folks on the question that we just asked a moment ago to you. Have you come into bear with me one moment. Have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. We will have another 30 seconds before we close that call out. So stand by and we will finish up that in a moment. So our next question. How will we find out if a transported patient tested positive or not? Who will notify the first responders?
So when we have those type of cases, the hospital notifies Assistant Chief Lamont, and then it falls down the chain of command. It goes through EMS and safety officers, and then the crews will be notified.
All right, thank you, Chief. So our next question, will essential employees receive time off for working while non-essential employees are getting time off or receive time off at a later date?
The short answer is we're not treating essential and non-essential employees any differently, especially as it relates to pay or time off. They're treated the same.
Our next question goes to the ordinance that was passed yesterday. Will we need any special documentation to get to and from work and home due to the shelter in place?
No, everyone is fine. There are no employees who are part of the Birmingham Fire and Rescue need any documentation for moving from point A to B as it relates to home to work, work to home.
Our next question, at the station level, with normal logistical requests, is there any way to increase the supply of cleaning products?
We have done that, and any supplies that you guys need, all you have to do is make a request through logistics.
And you have already done there has already been a number of items that have been brought in over the last, can you tell us?
We've placed several orders so far, and we're about on the second week of April, we should receive more of the supplies that we've requested. So those supplies are continuously coming in. But if there's something that you need specifically, just make that request through logistics and we'll make sure we get it to you.
Okay, our next question is, why are we continuing to move employees around from station to station instead of limiting the possibility of spreading?
So to answer this question, we've placed those 2 ID units in separate locations to make sure we keep those units away from our regular apparatus, but we still have to maintain our normal operational efficiency. So that's something that will have to continue to go on.
Okay, this next question I'm going to turn to Ms. Medizik. If a Birmingham employee family tests positive, are there benefits for the family, as in wife or kids, if infected by the employee?
Under the current workers' compensation law, there would be no benefits for the wife or family of an infected officer if they should become infected.
All right, thank you, Ms. Medizik. Our next question, CDC has stated if someone shows mild symptoms, you are not to go visit a medical physician. Current policy states if you use sick time, bring in a doctor's excuse. How is this possible with the recommendation being not to visit a physician?
There was recently some information sent out today. Televisits are available to all employees if you need to see a doctor. You don't have to go have a in-person visit.
So just to put a fine point on what Chief is saying, that's not in contradictory of each other. Yes, if you're feeling mild symptoms, it is the recommendation you not go into a hospital. But you can, telemedicine exists. Many of us do it. We just don't call it that, where you can actually call your physician or you can FaceTime your physician, and based on the category of questions you go through with that physician that puts you in that position to answer, you're then satisfying having seen a doctor. In addition to that, is sharing and expressing to that doctor you need an actual written excuse given to you if that requires you to be out of work.
Okay, I'm going to move to our next question. This is going to be our last question for now. If it were readily available, would you be tested for COVID-19? If it were readily available, would you be tested for COVID-19? Press 1 for yes, and press 2 for no. That question will be open for about 2 to 3 minutes, and then I will remind you once again, and we will move on to our next topic. Here's another question for you. What can be put into place to ensure employees find out test results of crew members earlier?
That's something that we'll be letting crews know as soon as we get the information. It's typically been taking 2 to 4 days, sometimes a little bit longer to get those results in. So it's really based on how long it takes to get the results back in.
I'm going to turn this next question over to Ms. Medizik. If a person is tested positive for COVID-19, what's the workman's percentage to be paid out?
Pursuant to the workers' compensation plan, and that way it's handled by the city, for the first 180 days of any absence related to a work-related injury or illness is paid at 100%.
All right, thank you, Ms. Medizik. Our next question is directed to Chief Moon. Would it be feasible for engine companies to have temperature monitors on call instead of waiting for them to be dispatched?
That's a good question. That's something that we've actually been working on from the very beginning. We ordered some of those scan temperature thermometers early on, but we found out they weren't hospital grade. There could be a variation in the degrees. Also, we reordered some, and we should be getting those hopefully in the next month.
All right, thank you. We're going to follow back up on that question that we opened just a little while ago. The question was, if it were readily available, would you be tested for COVID-19? Press 1 for yes, press 2 for no. Press 1 for yes, press 2 for no. Our next question that we're turning to, if an employee in a department is tested positive, what steps are taken to inform employees who have been in contact with that employee? Let me read that again. If an employee in a department is tested positive, what steps are being taken to inform employees who have also been in contact with that employee? Ms. Medizik, can you address that?
Yes, if an employee were to test positive, HR and the department director would make arrangements to contact individuals with whom they had had personal contact in the last 14 days.
All right, thank you, Ms. Medizik. Once again, a reminder for you, press 7 if you have questions for us, press 7 if you have questions for us. There was a follow-up on that. Bear with me. I closed it out for a moment, so I'm going back to it. There was a follow-up question on that. With the question you just answered, Ms. Medizik, does that qualify for workman's comp, or would that be a scenario for us to borrow time?
Depending upon what the circumstances are, either that would be covered by workers' comp or you would be eligible to borrow time.
All right, thank you, Ms. Medizik. Go ahead, I'm sorry.
I was going to say, and then the city is currently reviewing the new federal legislation that came out relating to emergency sick leave, and we'll have some guidance relating to that next week.
So this is a question we addressed just a couple of minutes ago, but it looks like this may be a new caller on the line. So I'm going to ask it again, Chief. Do we need to start taking temperatures of the staff when they report for shift?
Well, we started that screening process, and the supervisors are supposed to screen all employees for their work shift. We're looking for those signs and symptoms of shortness of breath, cough. If the personnel feel feverish, then we're asking that those personnel not work that day. We don't currently have the thermometers to check temperatures every morning. So.
But you said you are currently.
We're working on getting thermometers for all engine companies.
Okay. Our next question, again to you, Chief Moon. Can the department get sanitizing wipes for the stations and for the trucks?
We have those fogger machines to help decon the apparatus and the stations, and we have sanitized spray for all the stations.
All right, I'm going to do one more call. I think we've addressed these, so I'm going to do one more call for if anybody has a question, please press 7. Right now, please press 7, and we will try to get that call in. Just going through one more time. Okay, so just as a clarification for a previous answer, so I'm going to ask it and see if we can restate this. If employees have been exposed to patients that tested positive, but they were not offered testing through OHS, they were asked to contact their personal physicians or to go to testing site. I'm not sure if that was a statement or if that's a question. But let me just ask you what the protocol, if we can kind of repeat what we are earlier.
Yeah, we're still following the same protocol on testing. If personnel aren't showing signs and symptoms of the COVID-19 virus, then they're not being tested. There's limited supplies for testing all over the country, so they're only being tested when they're showing signs and symptoms.
All right, thanks, Chief. We've got 2 more questions that are popped up, so I'm looking for this. If an employee has been exposed and filled out proper paperwork, well, I think we just asked this question. I apologize. Will that employee be tested?
Yes.
And so this is the question I was looking for. If tested positive, how long will they have to be off?
The standard answer for that is 14 days, but each case will be judged on a case-by-case basis based on how long your signs and symptoms last, how long it takes you to recover, how long it takes to get the test back in. But the standard answer on that is at a minimum 14 days.
This question concerns firefighters working 2 jobs. If we go into swift activation, how will this affect firefighters working with other fire departments' jobs?
For this question, which is an excellent question, Birmingham Fire Rescue is considered everyone's primary job. Anyone who has a part-time job would have to get signed off from the mayor for those part-time jobs. So all that has to be signed off on. Chief,
thank you very much. That's all the questions that we have in the queue at this time. So I would like to turn back to Mayor Woodfin. Before he speaks, I would also like to remind folks, if you have a question that has not been brought to our attention, or if you want to ask a question after this, you can stay on this line, press 7, and that question will be saved and will go into the queue, and we will follow up. Another reminder for you is we will put these questions online at birminghamal.gov/coronavirus, birminghamal.gov/coronavirus. It won't be instant. These are large files that we have to download, so allow us a few hours to be able to get that, but we will put that up at that location for your reference or to share with others who were not able to join us on this call. With that, I would like to turn to Mayor Woodfin for closing comments.
Before I do that, I would like to defer to Chief Moon if he has any closing remarks before I do.
So the last thing I want to say to all our personnel is I want to start by thanking you for putting your lives on hold and constantly responding to these calls and continuing to provide excellence through service. The department and the city is counting on us to be on the front lines for this. We're living in unprecedented times right now, so I appreciate everyone's patience. If you see gaps in our coverage or our response or our protocols, that's something that I want to know so we can correct those gaps. This is an extremely fluid situation. The information that we have today may not be the same thing that's the current information for tomorrow. So we're constantly updating our protocols. But I want to thank each and every one of you for always continuing to be professional and providing that service that our citizens need. So thank you.
I want to first start by thanking Chief Moon. I want to then thank and his entire leadership team. I also want to thank you all for being on this call, being on the front lines and being our first responders. You all make risks and take sacrifice every day. As Chief said, we are in unprecedented times in this community, in this state, in this nation, and in our world. Because of that, this is extremely fluid. What was true yesterday and what is true today possibly could be very different tomorrow. Please be in a situation to ebb and flow and roll with us. We will continue to monitor every personnel situation related to COVID-19. We'll continue to monitor every human resources related problem to COVID-19. And definitely, you all are our priority. A day doesn't go by where I'm asking my Chief of Operations and my Chief of Staff checking in with Chief Moon to make sure our frontline men and women are okay. In addition to that, I want to make this very, very clear because I mean it. It's a lot of, I don't know what the talk is out there, but I want you to hear it directly from me. I and the team genuinely care for you as individuals and as a collective team. We appreciate the sacrifices you make and the commitment you've made not only to your profession, but to protecting and putting people first in this community. So from the bottom of my heart, thank you, and we will continue to create different channels and ways to stay in constant contact and communication with all of our employees. Thank you so much and have a good day.